Hello, good morning or good afternoon, depending on where you're joining us from. My name is Rebecca Vallis. I have the privilege of serving as the CEO of the National Academy of Social Insurance. Thanks so much for joining us today, and we have a great program lined up for you. As it marks its 90th anniversary, Social Security has become the cornerstone of economic security in the United States, providing a suite of insurance that protects workers and their families in the event of retirement, disability, or death of a breadwinner. But as we've all known for quite some time, the program is facing a long-term financing gap. And according to the 2025 Trustees Report, which was released just last week, Social Security will have sufficient funds to pay all scheduled benefits until 2034. While lawmakers have never failed to act to ensure that legislated benefits are paid in full, if Congress didn't act, this would mean a roughly 1/5 across the board benefit cut upon reserve depletion in 2034. And to help us understand the latest trustees report, we are so glad here at the Academy to be joined by Social Security Administration Chief Actuary Karen Glenn. She'll be followed by a panel of Academy members who are deep experts: Kathleen Romig from the Center on Budget and Policy Priorities, Andrew Biggs from the American Enterprise Institute, Joel Eskovitz from AARP, and Tracy Groniger from Justice and Aging, and they'll all get a chance to react to the trustees report and, importantly, to help us put in context what are lawmakers' options for addressing the gap and Americans' views on the path forward. So with that, I'm thrilled to hand things over to Karen Glenn to give us an understanding of the 2025 trustees report. Karen, thanks so much for joining us today.
You're welcome, Rebecca, and thank you so much for the nice introduction. Really happy to be here today. So I am going to go through a brief overview of the results of the trustees report, which, as Rebecca mentioned, just came out last Wednesday. So let's get right to it. Number one, just as some background, what is the legislative mandate for the Social Security Annual Report? There are a couple of things that are required by the law. Number one is the trust fund operations of the past year and the next 5 years. Number two, and kind of the big deal in our perspective, is the actuarial status of the trust funds. What does that mean? This is really the ability to meet the cost of the scheduled benefits with the scheduled revenue and the trust fund reserves. And that tells us the extent to which that scheduled revenue would fall short under current law, indicating the size of the legislative changes that will be needed. And just a little bit of bragging, the Social Security Office of the Chief Actuary has produced this report every year since 1941. So what are the big changes this year? Number one is a change in law. Many of you, I'm sure, have heard about the Social Security Fairness Act. This is a law that was enacted on January 5th, 2025. It repealed the windfall elimination provision and the government pension offset. The repeal of those two provisions increases benefits for many people who worked in jobs that were not covered by Social Security. So obviously, if you're increasing benefits, that's more money coming out of the trust funds. It is not a good thing for the financial status. Then there were a couple of assumption changes that the trustees made this year. Number one was related to fertility. The ultimate total fertility rate, which is the rate we assume in the long term, remains at 1.9 children per woman over her lifetime. That is unchanged from last year's report, but we did make a change in the path to get there. So we are assuming now that the ultimate rate isn't years later than it was in last year's report. So going from current low levels, which are about 1.6 these days, a little bit higher, we're assuming it'll take longer to get back up to that 1.9 level. The other assumption change this year was in the labor share. Those of you who have an economics background are probably familiar with this assumption. It's really just the ratio of total labor compensation to GDP. That is assumed to reach a lower long-term level than we assumed in last year's report. And this just reflects better recent historical trends and implies somewhat slower average earnings growth in the near term. We'll talk a little bit more about that in a couple of slides from now. Going back to the birth rates, under the intermediate assumptions, as I mentioned, the birth rates are projected to go to a level of 1.9 children per woman over her lifetime in the long term. You can see way over on the right side of the screen, we've got the alternative two assumptions, which is the trustees' best estimate. The trustees also do sort of a high cost and a low cost version of all the assumptions. You can see here that the range of those assumptions is from 1.6 at the low end to 2.1 at the high end. So just covering a range of possibilities. This graph here shows for the year of birth of a mother, so starting in 1901, going all the way out to 2046, so women who have not been born yet, just the variation in those total fertility rates or number of births per woman over time. The purple on the left side of the screen is historical experience. So you can clearly see the effects of the baby boom, where women were having over 3 children per woman. That came way down after the baby boom. And it has sort of been at a level near 2.0 since then. We do project that to go down in the future. Getting back to the other assumption change, this is the ratio of labor compensation to GDP or labor share. The red line shows the historical values, and way over to the right side of the screen, what we are assuming in the projection period for the 2025 Trustees Report. You can see that the level in the projection is slightly lower than it was in the 2024 report. Again, just better reflecting the experience of recent decades. There's a clear trend downward in that value. And that's just saying that less of compensation is going towards, less of GDP is going towards compensation rather than capital. So that's been a steady trend over the last 70 or so years. And the trustees are just better reflecting that trend going forward. You can see that there is still an assumed jump up from recent very low levels. We believe that's a bit of an aberration, but yeah, definitely a small change in the assumption, which has notable effects on the projections overall. A somewhat good news story here. Disability incidence rates do remain near historically low levels. They were very high back at the time of the last recession, the Great Recession. Incidence rates have declined significantly since then, as you can see. And it is a little bit of a mystery as to why they went down so much during that period. There are several factors that contribute, obviously. Some of them just include the changing nature of work. People are more able to stay in employment these days for various reasons. Jobs are not as physically taxing as they used to be. And there are more accommodations by employers, more use of telework. It is just allowing people to stay in employment a little bit more. You can see here that the trustees are expecting a jump up in the disability incidence rate over the next few years. That is number one, to get us to more of a long-term historical average level. And also because the agency will be working down some disability backlogs. So we do expect a big ramp up and then getting to those longer term historical averages. One thing a careful viewer of this slide will see is that the rate is very slightly higher in the 2025 Trustees Report than it was in the 24 report. That is due to the effects of a regulation that was implemented last year, changing how the number of years of past relevant work that are included in disability determinations. makes it a little bit easier to get on the disability rolls. So that is reflected in the long-term assumption. All right, so the headline numbers for the trustees report are always what years are those trust funds going to become depleted? Um, OASDI, which is old age and survivors and disability combined, those reserves are expected to become depleted in 2034, as Rebecca mentioned earlier. That is versus 2035 in last year's report. And that change is mainly due to the things we discussed already. The implementation of the Social Security Fairness Act, the change in the year the assumed fertility rate is reached, although that one does not have too much effect on the depletion year because changes in fertility rates don't affect us until about 20 or more years out. And the reduction in the long-term assumption for the labor share. OASI, old age and survivors by itself, is expected to become depleted in 2033. That is the same calendar year in last year's report, although it is 3 quarters sooner. So last year we were assuming the end of 2033. This year it's more at the beginning of 2033. And as mentioned already, DI reserves are not expected to become depleted over the 75-year long-range projection period, same as in last year's report. DI is in good shape these days. This graph here just kind of puts a fine point on how close we are to reserve depletion. The blue line shows you what we have been projecting for that combined reserve depletion date ever since 1991. You can see, especially over the last 14 years, 2012 to 2025, the projections have been very stable. They've fallen in the range of 2033 to 2035, with little bits of variation depending on the assumptions and the economic cycles. The thing to note here is we've got this dashed line, which shows you the year of the report. And the gap between those two lines is how close we are to that reserve depletion. You can see that obviously now we are more like 8 or 9 years away rather than 50 years back in 1991. So something needs to be done in the next 8 or 9 years, or else those reserves will become depleted and there will be an automatic cut in benefits if nothing else is done. All right, I am not going to go over this next slide in any detail. This is here for reference for folks who are interested. Another measure we tend to look at is the actuarial balance over the next 75 years. And in this year's report, that measure is minus 3.82% of taxable payroll. One way to think about that is that if we increased the tax rate for the program, so from the current 12.4% that folks were paying in, if we increase that by another 3.82%, we would just about have solvency for the next 75 years. There are a couple of nuances in that measure. It's not exactly right, but that is a good way to think about it to give you a frame of reference. In last year's report, that same measure was minus 3.50. So you can see that that increased deficit means that we are in worse shape this year compared to last year. And this table here just goes through all of the changes. We do a detailed breakout of what things had what effect. You'll notice here that the things that had the biggest effect were the Social Security Fairness Act, as already mentioned. The year the ultimate fertility rate was reached, also already mentioned, and that change in the labor share assumption. Everything this year tended to go in one direction, leading to that bigger actuarial balance we've got this year. All right, this graph is probably familiar to many of you. This graph shows you the Social Security trust fund ratios. This is just the annual reserves as a percent of, the trust fund reserves as a percentage of annual cost. Um, Under the trustees' intermediate projections, it shows all the trust funds separately. So you've got DI in the blue. You can see very clearly that that's going up over time, meaning that DI is in good shape. The OASI fund by itself is in the red, and the OASI and DI funds combined are in the black. Because OASI is so much bigger than DI, it kind of overwhelms the combined funds. So those two lines, the red and the black, are not all that different. But it does show you that the projections have been pretty stable over the last couple of years, with slight changes moving the depletion dates sooner. One thing to note on this graph is the tax rate reallocations we're showing on the blue line. A couple times in the 1990s and the mid 2010s, Congress, when it saw that the DI fund reserves were getting very low, they decided to reallocate some of the tax rate to the DI program to improve its financing. You can see that this had a significant effect in the 90s. We were going down to zero, it bumped up, but then DI was on its way back down again. In the mid 2010s, same thing. There was a little bit of extra taxes that went to DI. That kind of pushed it over the edge and put it on the trajectory it's on today. One question we've heard is, could that go the other way? Could we reallocate some of the tax revenue from DI to OASI? Would that help OASI? Yes, it would help a little bit, but just because OASI is so much bigger, anything you do there from the DI fund would not have a significant effect. All right, another graph we love to show. This just shows you annually the difference between the cost and income of the program. This is as a percent of taxable payroll. You can see clearly that the cost of the program, which is the blue line, has been higher than the income ever since about 2010. The large increase in the cost between 2005 and about 2030 that you see here is really because of the aging of the baby boom. No surprise, this has been projected for a long time, but it really is those demographic factors that are affecting that. The red line, which is the income to the program, has been pretty stable over the years at about 13%. You get some blips due to economic cycles and various other adjustments, but in general, it really does remain relatively level. Now, what happens in 2034 when the trust funds are expected to become depleted? At that time, benefits, the trust funds can only pay out what's coming in. So at that time, the cost line would drop down to the income line for the rest of the 75 years. So the gap you see after 2034 between that dotted line, which is the cost of the scheduled benefits, and the solid line, which is what can actually be paid, is really the gap that needs to be solved by legislative changes. This box at the bottom here shows you how much can be paid after reserve depletion. And if there's one message that gets across to everyone, trust funds do not go to zero at 2034. They will still be bringing in income. People will still get benefits, just at lower levels. In 2034, we expect about 81% of scheduled benefits to be paid. By 2099, that drops down a little bit to 72%. But clearly, it's not nothing, but that is a significant drop in people's benefits. Something needs to be done. Very similar picture here. This, instead of looking at things as a percent of taxable payroll, just looks at them as a percent of GDP. You can see again, the gap between the cost and the income is what we've got to solve. And the question is this 6% cost, are Americans willing to pay that? Do we think that's a reasonable place for our social insurance system to be? That is a question lawmakers and really the American people will need to decide. All right. Now, why are we in this position we're in now? I mentioned before that demographics are a big deal, and they are. The change in the age distribution of the population over the last several years and continuing into the future is really the primary reason for increasing cost relative to payroll and GDP. This graph shows you the black line, actual agent dependency ratios. This is just a simple ratio of the population at ages 65 and over, which is basically our beneficiary population, to the population at ages 20 to 64, which is basically the working age population. The more people we have paying in versus getting benefits, obviously that's better for the system. This ratio has changed significantly over the last several years. Now, what this graph also shows is what would have happened if birth rates had stayed at those high levels we experienced during the baby boom. This ratio would not have changed as significantly as it has, and we wouldn't be in the financial position we are now. Now, that said, we have always projected that birth rates would be going down and that this would happen. So, this is kind of a known effect, but it really is one of the main factors for putting us in the financial position we're in now. Now, this graph here is sort of the unknown factor. This was something we did not think about or project several decades ago. This graph shows you the what we call the taxable ratio. This is the ratio of all taxable earnings to the earnings that are covered by OASDI. And this ratio has declined since 1983 pretty dramatically. Obviously, you've got some ups and downs due to economic cycles, but this has declined due to increasing concentration of earnings at the top of the distribution. You probably all know that only about, what is it, $176,100 of earnings this year are covered by Social Security. So earnings above that level do not get taxed for Social Security purposes. The percent of people that have earnings above that level has remained relatively level at about 6% for decades now. But the amount of earnings falling over that level has increased significantly. And that's what this graph is showing you. The trustees expect that to basically level out in the future at about 82.5%, but that decline from about 90% to 82.5 has put the trust funds in a worse position than we had thought. All right, just quickly, how do we eliminate the Social Security long-term actuarial deficit? It is a simple math problem. It's a difficult political problem. And this is what our panelists, I'm sure, will discuss today. We need to make choices addressing that shortfall between 2034 and 2099. We need to raise scheduled revenue by 2034 by about 1/3. We need to reduce scheduled benefits by about 1/4, or some combination of the two. There are many, many different ways to do this, but we just need to find a solution that is palatable to all. So, bottom line, these long-term projections do provide information to assess solvency and the changes needed to eliminate the shortfalls. If the trust fund reserves were to become depleted, full benefits could not be paid on time. There would be no pressure on the budget or the federal debt because Social Security is off budget. But bottom line, Congress needs to act as it always has. And these are straightforward solutions. We need to either add revenue or lower cost for OASDI and implement those changes by 2034. And finally, just a little advertisement for our website. There is many, many pages of information there. We've got this year's Trustees Report, all prior years' reports, detailed single year tables, estimates for comprehensive proposals and provisions, and many other items of interest to this audience. So with that, let me turn it back to the panel.
Thanks so much, Karen. Really, really, really appreciate you taking the time. I know you've been on the circuit sharing all of these findings all week. We really appreciate you joining the Academy community. It's always so valuable hearing from the Office of the Chief Actuary. So what I'd love to do at this point is actually just to answer one question that we got, and then we're going to segue into our panel discussion. One person has asked a question I suspect others are wondering as well, which is, will the slides that you've just shared be available? And so just want to say we are going to post the video of this event on the Academy website afterward, along with materials, and we'll see if we can get those slides up there. But either way, the video from today will be available. So moving to our panel, I would love to welcome Kathleen and Andrew and Tracy and Joel up to the virtual stage. And so as they are being moved in there, I see them all. Hello, hello. Thank you to all of you for taking the time to join us today. And I've really been looking forward to this panel discussion because I know each of you has been spending a lot of time since last week diving in, reading the report, and thinking a lot and commenting a lot in the press and in other spaces about it from all of your different perspectives. So to get us into the conversation, and I sort of feel like each of you needs no introduction, so I'm not going to do long bios for each of you. I think you're all well known to this audience. What I'd love to start off with is just a little lightning round to give each of you the chance to react to the findings from this latest trustees report, and to what Karen just offered in terms of what we know about Social Security's financial outlook. So starting with you, Kathleen, what is your top takeaway from this year's trustees report?
I guess I would say it's really time to get serious about Social Security. I think that people, policymakers and the public to some extent have kind of tuned out of this. And I think, we all have so much skin in the game for what happens next. And we really need to start having a serious conversation about what the next steps will be.
I think that's a great place to start. And I suspect everybody on this panel is in agreement with that. Joel, I'd love to go to you next. What is your top takeaway?
Well, I realize this is a takeaway I could probably give every year, but I think it bears mentioning just the same because you read stories that leave the impression that the entire program is going broke. And so Social Security will pay benefits for the next 75 years and beyond. Sometimes those of us in the policy space gloss over this fact, but many Americans think that the program just ends in 2034. So I want to be clear, what we're talking about today is really a 20% problem. How do we fund the remaining 20% of benefits beyond 2034?
It's such an important reminder, and you're right, it doesn't get said often enough, and so that myth ends up being out there and penetrating, and I'm sure Karen is probably appreciating you underscoring that fact. Tracy, what's your top takeaway from this year's trustees report?
Yeah, I think that, following up on Joel reiterating that people are going to get benefits no matter what, we need to make sure that we're not leaving behind the lower income older adults who will feel that 20% really significantly. So it's true that people are going to get benefits, but we can't assume that they're all going to be perfectly fine and that it's not going to be felt. And so I think we really need to think about how we're making sure that people who depend on these benefits are going to be able to get them, and what we need to do to kind of readjust some of that wealth distribution that seems to be taking from the program so that everyone is able to retire comfortably and live well as they age.
I appreciate that so much, Tracy. And I know others agree with you. And I know Andrew does, because he's done so much writing about how much we need to focus on elderly poverty as really a core goal of what we do with Social Security. Andrew, what's your top takeaway from this year's trustees report? And then we'll get into it from there.
Well, thanks for having me here today. I think that the discussion of elderly poverty is super relevant, and often Social Security and Social Security reform are framed in terms of the safety net, in terms of social insurance. At the same time, I think it's worth framing or discussing the actual dollar level of benefits people will be receiving. And if you look in the trustees report table for this year, by 2033, which is the last year of solvency for the retirement trust fund, a two-earner middle-income couple will receive around $65,000 in combined benefits. So that's 3 times the elderly poverty line, before touching any of their own savings. The maximum benefit for 2 earner couples around $106,000. Those are very high levels of benefits at the top end compared to what other similar countries pay. So as we are forced to reconsider Social Security, I think we want to think fairly big picture about what we're trying to do and where we're expending our resources.
Yeah, it's a great place to start. And I think everyone's going to have thoughts on exactly where you've just taken the conversation. Joel, I'd love to go to you next because the Academy was really thrilled to partner with AARP and others. I want to give a shout out to the folks at the National Institute for Retirement Security and also the Chamber of Commerce, doing some public opinion research recently, asking the American people what Social Security means to them as we mark 90 years of Social Security, but also asking about Americans' views on what they want lawmakers to do. And so to Andrew's point about how we often hear about Social Security framed in terms of poverty, I'm curious if you could share a little bit about what we know through that research and what you know from AARP about the role that Social Security plays in Americans' retirement security at different levels of income.
Yeah, I mean, I think one of the more fascinating things to come out of that survey was we asked a question about whether, having no benefits would have any impact on your monthly budget. And we assumed that, that would change over the course of the income levels. But it was really surprising. Only 2% of the people said it would have no impact if, their Social Security income was reduced. And so it goes to show that although we think about and discuss Social Security as a safety net program, all Americans, for the most part, rely on the program in some form or fashion. And furthermore, when we posed a variety of different questions, it was very clear that benefit cuts were not an exciting option. We asked that question probably a dozen different ways. And if you think about it as a binary, between increasing taxes or cutting benefits, the solutions that Americans came up with were that they were willing to pay more into the system to ensure that benefits are not cut. And it was a fairly, common response across the income level, but also across political party, basically every demographic. When asked for solutions, people were willing both to pay more themselves, and obviously they're always willing to have upper income people pay more into the program. But I found it surprising that they were also willing to pay more themselves.
Yeah, and I definitely want to spend some time getting into that because as Karen set up beautifully, right, we basically have two categories of options as we're thinking about what to do for the future of Social Security if Congress is going to act. And we have no reason to expect that it won't because it's never failed to act in the past. The question is just when and what does it do? But we've got category one of cut benefits, category two of bring in more revenues, right? And that's some of where you started to go. So we'll come back to that and pull on that thread a little bit more. But I'd love to give both Tracy and Kathleen a chance to get in on this too, because I know they both think a lot as well about what does Social Security mean to people's economic security. So Tracy, talk a little bit about some of where you were heading before, what Social Security means to people beyond dollars and cents. And then Kathleen, I'll bring you in on this point as well.
Yes, Kathleen is my buddy on this because I'm always looking at CBPP data, and really it highlights how important Social Security is to older adults. We lived in a world in the past before Social Security where there were such high levels of senior poverty that we kind of can't imagine that world. People are depending on Social Security to lift themselves out of poverty. It's over 16 million older adults, over 22 million people if you include like all the other people who are receiving Social Security benefits. And it's really a critical program to keep people from living in a world where, they are in dire poverty. And I think that, as we talk about, low income older adults, middle income older adults, people expect a certain level of support now that they don't have through other means. And so it's been really difficult, as people have been losing pensions and losing access, the savings is really difficult in terms of retirement accounts. We've seen, the stock market go up and down, and people don't have that level of security that they do from the Social Security program. And so I think that, when we're looking at how people view the program and how important it really is a vital program to so many millions of people. We kind of almost take it for granted.
Yeah, and Kathleen, join in on that point, but I also want to add one other element here. Social Security is almost always talked about as a retirement program, but really important to remember it's also a really important disability insurance program. That's part of what Karen spoke about before, that being one of the core aspects of what this trustees report gives us information on every year. But we also know Social Security is really important to people who experience disabilities. Talk a little bit about what Social Security means to people who experience disability, in addition to commenting in any way you want on what Tracy offered about what it means in retirement.
Yeah, sure. And survivors, we have to, it's the old age survivors and disability insurance program. And I think, and if you don't mind indulging me for a moment on that, that's something that a lot of people just don't understand. They don't even, they haven't even heard the term survivors insurance. So, for those of you who aren't aware, that's Social Security's life insurance policy. And for a family of, for a young worker with a spouse and 2 children, that life insurance policy is worth almost $1 million in face value to a private insurance policy. It is such a big deal for, especially for children whose parents die before they reach adulthood. So I just wanted to put a little plug in there for that, because it is, not as many children are enrolled in that program as should be when their parents die, because it's just not as well known as the other parts of Social Security. But certainly disability is super important too. Social Security disability insurance supports millions of workers who have substantial earnings records and are not able to continue to do self-supporting work because of their disabilities. And that's a really big deal, because many of us don't have private disability insurance, and nor do we have private life insurance. And so that, those disability benefits mean the difference between being able to get by or not when a person experiences a life-changing disability. And I would love to talk more about elderly poverty too when we get back around to it.
I think we absolutely should, and I think that's part of where Andrew's going to want to go too. So
Yeah.
So Joel started to take us to some of what we know about what the American people want lawmakers to do. And folks can find the polling. It's at the Academy website, nasi.org, actually has it as the first hit. So you can see all the polling there. But Joel, you started to talk about how across party lines, across income levels, across education, across generations, what we found in that polling with you all was that people want to see revenues brought into the system and don't want to see benefit cuts. I have to be honest, I was a little surprised by some of the findings, because it feels like we're in a moment where Americans can't agree on much right now. And to see this much bipartisan agreement about anything was kind of remarkable. But it was overwhelming, the bipartisan agreement of not wanting to see benefit cuts and wanting to see revenues in the form of wealthier folks contributing more by adjusting that payroll tax cap that slipped over the years. We can talk more about that, but also, as you noted, people being willing to pay more themselves by gradually increasing the payroll tax itself that applies to workers and employers. So I'd love to get into that. And I also want to give Andrew a chance to respond to this, because one of the things that often comes up when I'm talking about this polling with a reporter or on a panel is people will ask, well, man, that's just not the conversation I hear in Washington, right? That doesn't resemble anything about what I hear inside the Beltway. I didn't know revenue was even on the table, or that could even really be an option. So Andrew, kick us off. It's often said that if policymakers are not in support of bringing more revenues into Social Security, they're de facto in support of benefit cuts. That was a quote we saw repeated throughout a lot of the coverage last week on the Trustees Report. Where are conservatives on the revenue side of the equation?
Yeah, well, it depends what you call a conservative these days. It's, as Karen's presentation showed, there's a money in, money out problem. And um, and so you have both. I think the way to put it is sort of congressional Democrats have a political problem where many of them have proposed raising taxes pretty significantly in order to maintain promise level benefits, sometimes to expand benefits. And they understand the politics of raising taxes are difficult, which is why they haven't pushed it forward. Republicans these days have a simple mathematical problem, which is, the center of gravity in the Republican Party politically on Social Security has shifted well to the left. I mean, I worked in the George W. Bush White House, and he would have preferred to fix Social Security as much as possible on the benefit side. He knew he'd have to compromise, but that was his preference. Donald Trump has said, I'm not going to cut a penny of benefits for anyone, anyhow, anytime. Well, that's a great promise to make, but to do that requires what would be the largest peacetime tax increase in history. And if you look at other discussions going on in Washington these days, that's not where they are. So they really have a simple mathematical problem. They're not going to be able to pull these extra revenues from waste, fraud, and abuse, things like that. My real fear is when the rubber hits the road, they're simply going to say, well, let's just borrow the extra money. And you can only do that for so long. So that's where I really have a concern about where Republicans or conservatives or fiscal conservatives are on this, because they simply have to decide what they're willing to pay for. And that's, as Joel said, there's differences of opinion and sort of philosophical views on that, but you just do have this mathematical problem you got to come to terms with.
Well, and Andrew, I think, one of the things that I'm always struck by is there seems to be a conventional wisdom that people wouldn't support tax increases. And that may be true in a lot of contexts, but it seems that Social Security is sort of in a separate category. People understand that this isn't just it isn't just any tax. It's a contribution to something that benefits all of us and that benefits the people who contribute to it. So I wonder if that puts it in maybe a somewhat different category in terms of where the American people are. And this polling seems to suggest that. I don't know if you want to comment on that.
I tend to think of the revealed preferences of politicians, who I assume they know their business. And in the first 2 years of the Biden administration, when Democrats control the House, the Senate, the presidency, and you had this bill, it's called the Social Security 2100 Act, which would sort of phased out the ceiling on payroll taxes, essentially eliminating the so-called tax max, and was also raised the rate. And that had co-sponsorship at one point by 90% of House Democrats, which is much more than any other bill I've ever seen. That legislation never came out of subcommittee, never got a vote in committee, never came to the floor. And I think the reason is they just know that it's not simply whether raising taxes is popular or not, but there is an intra-party competition because other people want those tax revenues for other things. If you want to do Medicare for All or Green New Deal or whatever you want to spend that money on, it can't go to multiple things. And realistically, something like eliminating the payroll tax ceiling, that taps out high earners. You're not getting more revenue out of those guys. So then that precludes, I know some right-leaning people who are fine on doing that because it says it prevents progressives from spending on other things that I like even less. So there's this competition for those dollars, and people who are on the, in favor of raising revenues still have to decide where those dollars go to.
Yeah, appreciate all those points. Joel, I don't know if you want to speak to any of that, given your role in some of that polling.
Well, yeah, I mean, I think that's a fair point that there's only so many ways to get at upper income people, and actually, interestingly, what we asked a real detailed level of questions about how people would lift that cap if that's what they wanted to do, and one of the things they decided on was not giving money back to the upper income people who were contributing more money into the system, which is a little bit surprising. Usually there's a connection between what you put in and what you get out. And so, but I mean, Andrew is right to the fact that you're asking one group of people then to contribute more but not get more back, and then you're going to be asking them for money in other capacities. I will say this is in a payroll tax context, and a lot of the other situations you're dealing with more like income tax and things like that. But be that as it may, the survey did show that people were both willing, so they wanted to keep the cap where it is, but then tax folks they're making above 400,000, and then they were willing to pay an extra 1 percentage point in across the board for all people, for all workers, with again the idea that that would mean that benefits would not be cut. I think that was was pretty clear. And as you mentioned about, borrowing and things of that nature as well, yeah, that is not a long-term solution. And actually, there's another paper at nasi.org that talks about kind of what we're going to do in the meantime, because there will, I think the other thing that's clear from this report is that, 8-9 years is not a lot of time. And so regardless of if Congress acts, this year or in 5 years, there will likely need to be some sort of a temporary solution. But borrowing, is not a long-term solution. At best, it's a temporary solution.
And Joel, I'm going to throw you one more question, and then we're going to take us in a slightly different direction. But just since we're talking about higher earners and how much do people contribute, how much might they contribute? One of the things that you've looked a lot at over the years, and that AARP has actually published a lot about, is the effect of rising earnings inequality on Social Security's trust funds. And it feels important to understand that component of things as well, given that the tax cap, right, is part of that conversation. Talk a little bit about what inequalities rise has done to Social Security's solvency, and you've actually looked at the question of what would have happened if the tax cap had stayed fixed at 90% of covered wages, which is a wonky way to put that, but help us translate this into English and to understand how that fits in.
Sure. Yeah. So I'm Rich Johnson from Urban Institute, did some work for us. Basically said if that tax cap had kept up with the level that it was covering, the amount of wages that it was covering in 1983, about a quarter of the problem would have gone away. And so it won't solve the entire thing, but certainly that is added. That is one of the more unexpected things that has happened since 1983. We knew that there were going to be a lot of boomers that were retiring now. We knew about longer lifespans and things of that nature. We didn't realize how much of the wage growth would occur above the cap. And that's what we're not capturing. None of that money is being taxed and paid into the system. So people making $200,000 or more, I think it's also very surprising to most of your average workers that they don't realize they pay in with every check. That every 2 weeks or month or whatever they're paid at, they're contributing to the system. But for a lot of upper income workers, they stop paying in, as the year goes. And so there are lots of workers who don't pay all year into the system. And that, I think, is surprising, and people are often confused as to why that is the case when Medicare has no cap. So, but yeah, that has been a lingering problem, since 1983, is that number has not really risen the same way that wages on the upper end have.
So about a quarter of the solvency, a quarter of the financing gap being attributable there, and in dollar terms, if I'm remembering this correctly, about $1.5 trillion to the trust funds that hasn't gone in because of higher and higher earners escaping more and more of that taxation with the cap slipping. So Kathleen, I want to take us in a little bit of a different direction. You, in some of your reactions to the Trustees Report last week, you wrote a little bit about some of the policies and policy proposals that we've been seeing from current leaders and their potential effects on the trust funds in the coming years. Some of the things you have been watching are tariffs, immigration policy. Anything you want to bring in terms of what you're watching that may not show up in this year's report?
Sure. So the assumptions for this year's report were set in December before the Trump administration took office. And so, of course, that means that the report doesn't reflect certain changes that have occurred since then. One of the most notable is immigration, that the report this year, or the report assumes this year about 2 million net immigrants will enter this country, when in fact, it looks like net immigration is going to be 0 or even negative for this year. So that's a big difference in the short term. Whether those trends persist over the long term is another question, and one that the actuaries are going to have to grapple with in next year's report. But what we know right now is we have 2 million fewer people coming into this country this year who could have been contributing to the Social Security trust funds over the long term. And in fact, over the next 5 years, they're assuming 7 million net immigrants coming in. So, and I think we would all agree that that's not going to happen. And so that's going to have an impact on the economy at large. It's also going to affect Social Security pretty directly, because that's where Social Security's revenues come from workers. Another thing that's notable is just that we had a very strong economy back in December, and a lot of economists now think that their odds of a recession have gone up by a lot because of the chaotic nature of the Trump tariff scheme, the tariffs themselves, and also the unpredictability of those tariffs. And so, if we do go into a recession again, that affects Social Security very much. It means that we have fewer people contributing to the trust funds, possibly over, not just during the recession itself, but we've experienced these jobless recoveries in many of the more recent recessions. And so that will cause a short-term hit to the Social Security trust funds. And of course, tariffs directly raise prices on imported goods, and that means costs overall, and Social Security COLAs, and that makes the program more expensive. So at least in the short term, I think all of these Trump administration policies are going to affect the trust fund negatively. And then beyond just the policies that we've already seen, we're looking at proposals. So as Karen described, the worst change since last year, financing wise, was the passage of the repeal of the WEP and the GPO, and that hit the trust fund. It subtracted 6 months off trust fund solvency. President Trump on the campaign trail talked about essentially doubling down on that and removing an important source of revenue to both the Social Security and Medicare trust funds by repealing taxation of Social Security benefits. That didn't end up in the reconciliation package that Congress is debating right now, but presumably that's still on the table. And that would cause an even bigger hit to the Social Security trust funds over the long term. In fact, it would be a large and growing hit to both of the trust funds. And so, that's just the kind of thing that we don't need to be doing anytime, but particularly right now when the reserve depletion date is so soon. And when we've already, just had a big hit in terms of the so-called Social Security Fairness Act.
I appreciate all of that, Kathleen. A lot of context there and a lot of things to be watching. Andrew, I want to give you a chance to jump in on this as well. And I'll add one other component because I love a good multi-part question. That's that you mentioned waste, fraud, and abuse before, right? And so you'll probably have things you want to weigh in on that Kathleen's just raised, but adding the element of have the cuts that we've seen at the Social Security Administration, led by the Department of Government Efficiency, or DOGE, made a meaningful difference in terms of Social Security's solvency?
Sure. Let me first just touch on the Social Security Fairness Act, because I think, it raised the long-term funding gap for Social Security by about 4%. And, if your unfunded obligation is $25 trillion, every 4% counts. But what was really worrying to me about that was just a failure of policymaking in both parties, where anybody who's spent 10 minutes looking at this issue realized that the so-called Social Security Fairness Act, in fact, restored windfalls to mostly a section of state and local government employees who, to be frank, already have the most generous pensions in the country. And so it was just the fact that the members of Congress couldn't take the time to study an issue. Social Security reform come 2033 is going to be a lot more complicated than that. And so that sort of stuff worries me. Touching on the DOGE issue, Kathleen and I both, worked at SSA. I personally think there's efficiencies you could have. There's things you could do to, make things work better, make them work quicker, make them work more cheaply. At the same time, right now we're not going to know what is happening at SSA because there's not going to be publishing statistics anymore, which is, if the numbers were good, they'd be publishing them. So it is, there is a real advantage to understanding the systems. I really do like having, fresh ideas coming in. Is there new technology? Could AI help with customer service? There is evidence that AI really can help in those areas. But just doing it slash and burn, you have to know what you're slashing and burning before you slash and burn it. And I just think they weren't thinking that way. So I'll be surprised if you see meaningful improvements or cost efficiencies there.
Yeah, I appreciate you bringing up the customer service piece because I know that's a lot of what folks are watching, and that may not be exactly what the trustees report usually gets into, but it's definitely a hot set of issues right now at the Social Security Administration. We actually saw the newly confirmed commissioner testifying before the Ways and Means Committee just yesterday, talking about a lot of these issues. And you referenced one of the things that has been getting a lot of criticism in the press, which is the pulling down of a whole bunch of metrics that tell us about, what do wait times look like, right, et cetera, when it comes to customer service at Social Security. Joel and Tracy, I'd love to give you a chance to weigh in on this. And Kathleen, I think you may want to speak to it as well. Joel, what are you watching in terms of Social Security's customer service? Are you concerned about the pulling down of metrics that have historically been up under Republican as well as Democratic appointed commissioners? And what are you hearing from your members when it comes to accessing Social Security's customer service?
Yeah, I mean, we're hearing from members quite a bit these days, really, since some of the first changes went into effect or were announced. And that's been part of the problem, right? They've been announcing changes and then there's been pushback. And so then they've had to pull back from those changes. And so right now we get a lot of confusion and understandably so, because it's very hard to follow what's happening. I saw the commissioner yesterday in the testimony, and I was surprised that he was still counting, people waiting for a callback as though it was not waiting. But it is, they're still waiting for service, and there are still some metrics that they're putting online. I looked this morning though, there were still 10% of people that were waiting more than 3 hours, and that's on the metrics that they were publishing. So that's not a great sign. We certainly think that people need to be able to reach the agency to take care of business in the way that they want to. So whether that be in person in a field office, online, or on the phone. And sure, I mean, AI is apparently part of the plan, but again, you need to be thoughtful about how you put these things forward, especially when you're dealing with a population that may not be able to follow everything that is all the changes that are happening. So I don't want, people receiving Social Security to be the guinea pigs for that experiment. We really want to make sure that things are rolled out when they're ready, and not just because, they're overwhelmed with calls.
Yeah, great points, Joel. And I want to give Tracy and Kathleen a chance to respond to this as well. It seems to be that an increasing number of members of Congress are joining with advocacy organizations doing their own test calls to the 1-800 number to see what's happening, if the metrics are going to be pulled down. And some of what's starting to be reported is quite concerning, to your points, Joel, right, in terms of what's being counted as callbacks, but also people having calls dropped, and something like only half of people being able to reach a human if they want to, right? These are some of the things that are starting to be released. I'm looking at a USA Today piece that some Hill offices contributed to. Tracy, what are you hearing from your networks at Justice and Aging? You work with a lot of folks in the legal aid community in particular, and what are you watching on customer service?
Yes, I'm really concerned about the customer service piece because I think there are a lot of people who aren't being served right now. And I don't think that the metrics are really taking into account people's experiences. So even with, thinking about the chatbots and AI, we hear, this is such a great new way for people to engage. And, I'm all about modernization, but I really worry that, someone who calls and gets a chatbot and then can't actually have a conversation and then therefore hangs up, that could count as, a call, a successful, call. We don't know what those metrics actually mean. And so I think looking at, what are people's actual experiences? How are things being rolled out? And are they being rolled out thoughtfully, to Joel's point as well, is going to be really important, because older adults and people with disabilities who are trying to engage are encountering these barriers to access that are not being counted. And I think that, taking down these metrics is really a sign of the difficulties that people are having. And I think that we really need to push on SSA to show us, what they're doing to make sure that the most vulnerable people and the people who might have the most trouble getting into a field office, getting onto the phone, talking to an AI chatbot, how are they making sure that those people are being served and we're making sure that they're getting the access that they need?
Kathleen, you've been looking a lot at this as well. You've been writing a lot about this. This has been the subject of a bunch of analysis actually at the Center on Budget and Policy Priorities. Anything you want to add to what you're watching on customer service, or what your views are on some of those key metrics being pulled down from being reported?
Yeah, I guess I would say, I've been watching the Social Security customer service metrics for a long time. It's been a resource constrained environment for 15 years since the discretionary budget caps came into effect. And what I think it's really important that the public and congressional overseers have visibility into a broad and detailed set of metrics so we can understand what trade-offs the agency is making. If you just have a couple of key metrics, well, then it's really easy to game them. You can just put all your resources into one particular area. But the problem is when you don't have enough to go around, something's got to give. And we could see that before. To the agency's credit, under, Commissioner O'Malley had to put a big priority on transparency, and acting Commissioner Dudek as well published a lot, even more statistics about what was going on at the agency. And just to give you an example, Andrew and I were talking about the WEP repeal. Well, the agency put a high priority on processing those cases as quickly as possible. And in fact, yesterday, Commissioner Visignano said that they would be processed ahead of schedule by the end of this month. Well, what gave to make that happen? And the metrics were showing us that, actually. The metrics were showing us that in the Social Security processing centers that do a lot of the behind the scenes work, the backlogs were skyrocketing this year because those processing centers had put aside that other work in order to process the claims for these state and local retirees who, like Andrew said, already have other pension income. This is giving them a windfall on top of the generous pensions that they're getting from state and local governments. And meanwhile, people who had errors, who maybe weren't getting the benefits that they really needed to get by, or people who maybe someone's spouse had died and they needed to have their benefits adjusted so that they would begin getting the survivor's benefit, or any number of problems. Those people are languishing while the weapon GPO affected individuals are being served. So really, without a broad and detailed set of metrics, we can't see the necessary trade-offs that the agency is making, and we can't understand how well the public is being served.
Yeah, thanks for that, Kathleen. I know it starts to sound a little bit wonky talking about these kinds of metrics, but right, I feel like you did a really good job just now underscoring why they matter, right, and why transparency matters. So we've got questions starting to come in from the audience, and so I'll just do a plug. Go ahead and pop in your questions into the Q&A, and we're going to be turning to that in just a few minutes. But we had Andrew speak a little bit before, and Kathleen, you said you wanted to get back to this, so I want to make sure we have some time for it. But talking about senior poverty, right, and the role that Social Security plays, how well it's doing, and maybe how well it's not doing at actually preventing and eliminating poverty among older adults. So Andrew, you have proposed for some time actually radically restructuring Social Security because you think that a better way to achieve the goal of preventing older adult poverty is by having a flat benefit, and that's at the poverty line or somewhere near it, to prevent people from living in official poverty. I wanted to ask you the question, given that we do have the Supplemental Security Income Program, SSI, already as part of our Social Security system, and it's effectively a flat benefit. It's not quite at the poverty level. It's a little too low to achieve that goal. What would your views be on, instead of totally restructuring Social Security, including significant improvements to SSI as part of a Social Security solvency package? Wendell Primus has proposed this. Others have started talking about this. What are your thoughts? Should we just bring SSI up to or above the poverty level to prevent poverty among older adults? And maybe would that be a way to achieve some of those goals in a bipartisan agreement?
I think so. I mean, it's if you were say to increase SSI, which is a means tested welfare program for very low income, low asset individuals, here I'm talking about people 65 and over. If you were to increase that as SSI, and then do something on the top end to reduce benefits for higher income Americans, something like progressive price indexing. You would end up with a total system that is more similar to a country like Canada, where they're focusing much more of their resources on protecting against poverty in old age, much less of their resources on doing income replacement for high income retirees. And so I think that might be a way of going about it. You know, Australia has essentially a means tested minimum benefit, which is similar to SSI, but just more generous. When I think of the overall reform dynamic is if you talk about reducing benefits at all, you get a lot of discussion. Oh, no, you're going to retire into poverty, blah, blah, blah. Almost all of that's untrue anyway, but people need to be reassured that it's really not going to happen to them. So I think like really strengthening poverty protections at the bottom end would give people confidence of, okay, I might just save more if retirement on my own, but these worst case outcomes aren't going to happen. So there is this confidence building dynamic that goes on. And look, we're a rich country. Addressing poverty in old age is not a particularly expensive issue. So if we can do that as part of a larger reform, then I think that makes sense.
Well, and I definitely have been heartened by a lot of the bipartisan conversation that's been happening recently around how SSI does need to be improved in some significant ways and really should be considered as part of this Social Security conversation. You've actually been a big part of that, and you've written about things like the need to update SSI's asset limits, which haven't been updated since 1984, even for inflation, and which literally are a regressive savings penalty that nobody today seems to think is a good idea. Tracy, Joel, Kathleen, would love to give you all the chance to weigh in on some of what Andrew said. And should we be thinking about improving SSI as part of a Social Security solvency deal if we want to prevent poverty for folks in old age? And any thoughts you have about Andrew's flat benefit idea as a straw man?
I'm just going to mention a technical point, and then I'll turn it over to Tracy and Kathleen. But you know, as part of the solvency conversation, SSI is not really in that conversation because it's not funded in the same way that traditional Social Security benefits are. So by propping up and strengthening SSI, you're not doing anything to harm the trust fund or the future benefits. So that is one advantage also of looking at that. It doesn't make the challenge harder, and in some ways it could make it easier because you do have a real much stronger safety net. But I'll turn it over to Tracy and Kathleen for better points than that.
Yeah, I am all in favor of strengthening the poverty programs. Like, I think we should definitely start there, giving people some, confidence that we care about low-income older adults and that we're willing to make sure that the program works well. Because I think one of the challenges is that the SSI program is super complex and very difficult for people to understand and access, and we create barriers in a lot of ways to make it harder for people who are low income to get the resources and the help that they need to survive. And so the asset limit, the Savings Penalty Elimination Act is a bill that would raise the asset limit so that people can save more than $2,000 and still receive their SSI benefits. And this is a bipartisan solution to a problem that shouldn't exist really. But the fact is that when programs do become anti-poverty programs, oftentimes they can be left behind. It becomes less of a priority for people to make sure that the programs work well, and suddenly barriers do start to come up so that it becomes harder to access the programs. I think that we can really make SSI a robust program and also help people who receive Social Security. There are a lot of people who receive both Social Security and SSI, and they should be able to access money that allows them to live better than just at poverty level. I don't think our goal should be that all older adults live at poverty level or we just barely help them survive. I think we want the solution to be that everyone gets to live a full and fair life in retirement, and we have to make sure that we're not cutting programs or reducing benefits or making it more difficult for people to access that in some effort to make things cheaper, which is something that the American people don't seem to want to do anyway.
Well, and inherent in your very thoughtful comments, Tracy, also is right something that bears repeating, which is that the poverty level doesn't actually bear any resemblance to what it takes to afford a basic standard of living in the U.S. Right, so we could have a whole webinar, and maybe should at some point, about the history of the official poverty measure and Molly Orshansky and all of that good stuff. But Kathleen, anything you want to throw in on this point before we go to audience Q&A?
I'd love to. Yeah, thank you. Yeah, I mean, I think sometimes Andrew gets a bad rap on the left, let's be honest. But I think a
On
lot
my
of
too.
you do. But I'm coming to your defense. I think there are few people who have grappled more seriously and for longer on elderly poverty. And I just admire that so much about you, Andrew. And I think that it's something that we really should be thinking about seriously. Social Security is an incredible poverty reducing program, bringing 22 million people out of poverty last year, including 1 million children. That's a big deal. But you know what? 10% of elderly Americans are still poor. And we're spending an awful lot of money on Social Security and you know, is much smaller, but still a substantial amount of money on SSI to leave 10% of people in poverty. And the fact is, the Social Security program as structured is simply never going to eliminate elderly poverty, because there are too many people who don't get Social Security at all, or who just don't earn enough to get a poverty level benefit from Social Security. And so we have to think about this more seriously. And I really admire it that Andrew has, and I think his ideas are very interesting. I mean, it's hard to imagine beginning from a blank slate and starting over with a, you know, very radically different kind of program. But I think we do need to think about, you know, if we can't change it, if we can't change Social Security so much that it provides a floor of income to everyone. And I don't think we can. I think it's very important to people that there's a strong link between contributions and benefits. Then we need to think about, how do we create that floor of income, and how do we make sure, and yeah, if we are going to afford to do that, it probably does mean some compensating changes elsewhere. And so anyway, I think it's some very provocative ideas from someone who really cares about elderly poverty and has for a long time.
Well, thank you. If I could just touch on one point, there's a very good paper that came out from the Census Bureau in 2017, where they used IRS data to look at retirees' incomes, and that those data, administrative data, are much more accurate than household surveys like Current Population Survey. But one really interesting thing is when they broke out the income groups of seniors by deciles or tenths. Your poorest tenth of the population, they're really an SSI population more than a Social Security population. They're really getting a lot of their income from SSI. So thinking about SSI, if you're thinking about elderly poverty, it's almost more of an SSI issue than a Social Security issue. I mean, I've argued Social Security should take over some of that by just boosting benefits in the bottom end. But under current law, I think SSI is the more effective way of going about that.
Well, could it be that we've found some serious bipartisan consensus today? And let's mark this day down in history. Maybe there's a way forward. Thank you, Andrew.
If I could just add one more thing onto that. I know you want to get to Q&A, but like one illustration, I love talking about elderly poverty, but one illustration of that is the Social Security 2100 Act that Andrew mentioned, that even with all the benefit expansions within that, it barely moves the needle on elderly poverty. And so, I think we do have to think differently about how we address this. And I wrote a paper last year with colleagues from the Urban Institute about that, about how to build a better minimum, and funded by AARP. Thank you, Joel. About how to do that within Social Security. But the fact is, there are just limits to how much you could do within Social Security, and probably does require expanding SSI.
Well, I look forward to further conversations about how we think about the role SSI could play within our Social Security system. I think it's incumbent on all of us to be helping policymakers and the policymaking audience think about the two in tandem. We've got a little bit of time, but not that much, as Karen underscored for us, and as everyone has agreed. So with that, let's bring Karen back up onto the virtual stage, and let's do some audience Q&A. We've got lots that has come in. You guys have sparked lots of questions, so we're not going to have time to get to all of them. But let me start with a question from actually one of the Academy's former chairs of the board, Renee Landers, asks, focusing on the benefit side is important, but what are the best and most effective options for enhancing revenues? For example, what would the impact on long-term solvency be if we raised the amount of income taxed for Social Security, because the tax right now is regressive? We got into that very briefly before, but it's probably helpful to talk a little bit about the scale of some of these solutions. And Karen, I think you might be able to speak to that. And I think Joel, you probably can speak to that too, given that we used some of Karen's numbers for the polling that we did together. So Karen, do you want to take a first shot?
Sure. Let me start. One thing to note is that on our website at www.ssa.gov/OAZT, we score about 130 different provisions for making changes to the program, with details about the cost effects on all of them. Many of those are revenue provisions. And we talked a little bit about what would it do if we raised the taxable earnings to 90%, back to where it was in 1983. And I think one of you mentioned that that would close about 25% of the gap. So that is a significant change. Even completely eliminating the taxable maximum these days would not solve the entire gap. So while that would have been the case maybe 10 years ago, we are close enough to the reserve depletion at this point that it would not do it. There are other options as well. They're bringing in other sources of revenue, things like taxing capital gains and sending that income to the trust funds. Some people have even said maybe a wealth tax, tax the wealthiest folks on that wealth and send some of that to the trust funds. There are many, many different ways to do it. Again, take a peek at our website for some of the quantifications of those, but I'm sure others have thoughts on this as well.
Thank you so much for that, Karen. And the plugs for the website are always well due, because for a lot of the folks who are part of the Academy community, it's exactly the people who love the treasure trove that you guys have there. So definitely worth plugging. Joel, would love to see if you want to take a shot at that as well, given that we, as part of that polling initiative with you all, did ask some really specific questions that actually educated people about exactly how much of the gap would be closed, so that they could make informed choices about what they put in their preferred package. Do you want to take a shot at Renee's question as well?
Sure. And I think Karen makes a great point is, if you've been working in this space for an extended amount of time, a lot of things that would have solved the problem 10 or 15 years ago by themselves no longer do that. And so even if you lifted the cap entirely, that would not solve 100% of the problem. I think it was around 2/3, maybe a little bit north of that, but which goes to show that there are going to need to be, packages and some balanced effort at doing that, because short of just raising the payroll tax to by about 4 points, I think is what the shortfall is. There's no one thing that's going to do that, and as we've also discussed, it does matter now that the date of insolvency is so close that things that could have phased in, you always hear the people that say, well, just raise the retirement age and that'll solve the problem. It's like, but that is a long-term solution that could be pursued, but that doesn't address anything in the short term, really, especially if changes on the benefit side are phased in, which they have been in the past. So, the challenge is both the short-term funding issue, but then, thinking about this in a much bigger context that there are outside sources, but it also goes back to what Kathleen was referencing is, it depends on how much you want to kind of, I don't want to say blow the system up, but if you were starting from scratch, how you would do it versus how you're going to do it, in reality. And the system right now is a self-finance system where it's largely, through payroll taxes and income taxes on, certain people that are receiving a large amount of money in retirement. But
And Joel, staying with you for just a moment. So perhaps because we haven't actually said it, it's worth just doing kind of 60 seconds on what was the preferred package that Americans agreed on across party lines and income levels and education and generations. You mentioned that it was no one solution is at this point going to solve the whole problem. What did people put together when they were asked to assemble their preferred package?
Yeah, and people did actually solve the solvency. I mean, we didn't, that wasn't the goal of this effort, but I think people were really fixed on, when you give them the math that they want to try to do it. And so the top three options were the same. It didn't matter how you sliced it. The number one was that tax max and keeping it, at the level it's at, but then taxing those above 400,000 and then not crediting them back for the extra money that they put in. Number two was to raise by 1 percentage point the amount that employers and employees contribute into the program. And then the third one was no change to the retirement age. People were really not in favor of that. And the retirement age is, again, one of those things that, when you look at the math behind it, the savings that you get over the long term are not that substantial. And I think there are people for whom, it just ends up being, I mean, it is a benefit cut in general, but if you're claiming at 62 and that age is raised, it is a much harder benefit cut to swallow. And so that is a real challenge. And then there were other elements that varied depending on the groups that were surveyed, but by and large, the package that was approved had a caregiver credit for people that drop out of the workforce and then have years of no earnings. It had a cost of living adjustment that was more reflective of older American spending patterns. And there were a couple of other pieces in there that now I'm trying to recall the other pieces, but the bridge benefit, something for folks that were doing physically demanding work. So again, that early claiming penalty was not so substantial. But the top three were really the ones that were most significant and would do the most, well, certainly the top two in terms of helping with enhancing solvency.
Which is the addressing the cap, not by blowing it entirely. People didn't want to do that, but they did want that $400,000 donut hole and to eliminate the cap above 400K and then raising the payroll tax gradually, as you noted, on employers and employees. So there's a lot of questions about borrowing. And so I'm going to try and lump these together into one theme so that we can let folks respond. And some of these are directed at you, Andrew, and some are directed to the whole panel. So one, Mark Miller says, regarding the borrowing scenario to keep benefits whole, why can we do that for, quote, only so long as Andrew says? It would be deficit spending and there seems to be no limit to the appetite for that. I think that may be a reference to the tax debate that's happening right now, but he doesn't put that in his question. We also have the question, what policymakers have actually proposed and introduced changes in the law to allow borrowing to continue paying full benefits after the reserve depletion date. And we have a couple others that get at kind of similar themes. The possibility of general fund transfers if action is delayed to close to the X date, what other options would be feasible? So Joel, I don't want to make you do all the talking. I know you have thoughts here, so let's let Andrew get in first.
Well, when I said you can only borrow for so long, this was not to say, okay, the current insane level of borrowing is okay, but this incremental amount for Social Security wouldn't be. But where I see the danger is if you read all the kind of larger research and the sort of the modeling of sort of how much debt the federal government can carry before we end up, spooking the financial markets and having some sort of debt crisis. A lot of it depends if you look at CBO's models or others, there's built in this assumption that at some point, the federal government is going to raise taxes or cut spending so as to stabilize the debt. If you don't have that assumption, these computer models can't solve the problem. And so, I think the financial markets still assume that in the sense of the interest rates are not spiking, things like that. My fear is if you go to Social Security and you say, okay, well, we've been ticking down to this trust fund insolvency date. That's the drop dead date. We have to do something. if the federal government then announces its policies, we're simply going to borrow with no plan on paying it back, which is essentially what they would be doing because there is no plan to pay it back. If I were in the financial markets, then that would be the triggering event of saying, okay, I'm out of here. Because it's one thing to say, okay, we're borrowing from the on budget to repay the trust fund. Everybody kind of gets what's going on there. But if your policy for Social Security solvency is simply to borrow without end, that takes away the assumption of these sort of models that at some point we get on top of this problem. And so it's all of these things that talk about what could trigger a financial crisis. They say, we don't know what it is, but you need some precipitating event. The tariffs could have been the precipitating event. If you saw the financial market response to that, that could have been the precipitating event. But going forward and saying our solution to Social Security is borrowing, that could be a precipitating event. So it's not a dollars and cents thing. It's at what point do financial markets simply lose confidence in the federal government's ability to manage its finances?
To make sure that we have a chance to get through one or two more questions, I'll say for folks who are interested in more on kind of what are the options for borrowing and what do the American people think about those options, Joel referenced a report that's also on the Academy website written by senior fellow Elisa Walker that actually takes a look at a whole bunch of that. She just published that earlier this week. It contextualizes the latest trustees report, but also really starts to look at what happens if we do get close to that X date and there's the potential for a benefit cliff, which obviously nobody wants to have happen. So appreciate her work on that, and I'll refer folks to that. So we have a question of what is the status of conversations about privatizing Social Security? Kathleen, I don't know if you want to jump off on that, given that that connects to some of the customer service pieces we were talking about, but I think Andrew may have thoughts too.
Yeah, I think when people use that term privatization, they're often thinking about investing the Social Security trust funds in some fashion in the private market. But more recently, especially with DOGE in the federal government, they're also thinking about privatizing the services that the Social Security Administration provides. And to my knowledge, there is not a current conversation about investing trust fund resources in the private market. At least not a public conversation, but there's certainly a lot of talk about privatizing some of the services that the Social Security Administration provides. You know, getting like, for example, one thing that came up a couple of months ago when advocates met with the acting Social Security Commissioner was outsourcing the call centers for SSA. So that's definitely part of the conversation. That would be a big change at the Social Security Administration, and it. You know, often those kinds of changes are intended to make things, you know, more efficient or better service, but in many cases they do not pan out that way. So I think that's something that we should all keep an eye on.
Something that former Commissioner Michael Astro actually spoke about extensively in a prior Academy event, talking about some of what DOGE was doing and was proposing at SSA earlier this year. So Andrew, I don't know if you have any comments on privatization, and then we'll do a quick closing lightning round.
Yeah, the idea when people think of privatization, I just wrote a paper for AEI about the 20th anniversary of George W. Bush's kind of proposals. And when people think about privatization, they're talking about taking part of the existing payroll tax and investing it, say, in a personal account, something like that. Those ideas essentially now are dead. That, you know, 20 years ago, you had the Social Security surpluses, which, you know, people thought were being spent. The accounts could have saved them. Those days are gone. So and the idea of benefit reductions has also shifted. So I think we really do need at this point, you know, for better or worse, whatever, you know, I worked on those things, but whatever you think, it's a different discussion now. So if you're somebody who's afraid of privatization, okay, you got something less to be afraid of. We also have to start thinking about, okay, how in fact are we going to fix this program?
Well, a perfect segue into a closing lightning round where I want to give each of you maybe 20, 30 seconds just to say, what is your message to lawmakers? What should the takeaway for lawmakers be right now? And I won't make you say that, Karen. I'll give you the opportunity to say something else in closing, but let's do a quick lightning round for everyone. And then Karen, I think you can close with any closing message that you have. And Andrew, I'll give you the first shot.
3 words: do your jobs.
Kathleen, I'll go to you next.
Well, that was good. That was good. Hi, Bar. Remember the beneficiaries.
I love that. Tracy?
The people want you to act.
Joel?
Yeah, sooner you act, the easier the problem will be to solve.
Look at all this bipartisan agreement. Again, it's almost gobsmacking. Karen, I won't make you give a message to lawmakers, but any closing
goodness.
thoughts after this panel?
Everyone is so pithy. I appreciate that. But yeah, I think we here at the Office of the Chief Actuary are continuing to do the good work we've always done, just measuring the size of the shortfall. And we're happy to help any of you in the policy community and lawmakers to get to the goals they want to achieve. So thank you for having us here today.
Well, big thank you to you for taking the time, and thank you to all of our panelists, Andrew, Kathleen, Tracy, Joel, for joining us. Lots more where this came from. We could do another 2 hours and probably still not scratch the surface, but the Academy is going to continue to do its part to try to convene these conversations to, as Andrew said, find a way forward, right? Because that is what we need to do, and the clock is definitely ticking. So with that, I'll refer folks to the Academy website for a whole bunch of the resources that we mentioned today, including the polling, the report from Elisa Walker. We'll also do a follow-up email that has some of those resources in it. But just a big thanks to everyone for joining us out in cyberspace today. And thank you to our captioner and to our events team Strategy and Hustle for making everything look great and go smoothly. Thanks, everyone.